One. Good morning and good evening in India. This is Dr. John Bennett from Miami of InternetMedicine.com. We're here today with the affiliate of IndiaMedical.tv, headed by Dr. Suri. He has a couple of the host and a couple other people that are going to participate, and one more just dropped in. And I'll turn it over to Suri, and it's his show. Good day, Suri.
Yeah, John. Thank you, John. Welcome all on the platform of IndiaMedical.tv. It's our fifth presentation on the IndiaMedical.tv, and we are having a special guest from the Malaysia, Dr. Vinod, with the presentation on the topic of stroke rehabilitation. Other than our presenter, Dr. Vinod, we are having a special guest, Dr. Suresh Gupte from the US, and he is a physician. Hi sir, welcome on this platform. I am very happy to see you here. And one more person is there, eminent young physiotherapist, neurophysiotherapist from Delhi, Dr. Shiba. She already presented last time. Wonderful presentation. I welcome you, all of you, and just enjoy the presentation with Dr. Vinod. Dr. Vinod, can you introduce yourself?
Yes. Hi, good evening. Morning from Malaysia. I'm very glad to join with this forum to share some few knowledges what we could share among the professionals. And I was always interested in the stroke rehabilitation and a little bit on over the evidence-based practice. So today I'm going to tell about the gross idea what physiotherapists were doing in stroke rehabilitation. So this is what my today's presentation about and about myself.
Yeah.
Thank you. You have to click on the share button, Dr. Vinod. You got to click on the share button.
Yeah, already. Yeah, still you didn't get.
Yeah,
actually, I already did sharing.
Okay, not yet, not yet. You got to click the share button on your screen.
Yeah, I did share.
Already. Try it again. Try it again.
Still, you are not getting.
Yeah, we're not getting the screen. We'll get it. We're not. You have to go on that screen. Go on that screen and click the share option.
Wait a moment.
Yeah, click the share option.
I did.
That's okay. It's a new platform for everybody. Click on the share. Go to the screen and
okay,
click
once
on
again.
Yeah, try it again.
Oh, just a moment.
It's a new tech for everybody. While we're waiting, Suri, I haven't met the gentleman to your right. Who was he?
Just a minute.
Dr. Suresh, can you introduce yourself?
I guess. Okay.
Hello,
I guess
Dr.
John, are you getting my screen share? Not yet.
Oh, okay. We'll do that later. Sorry. No, not yet. Okay, just put on the screen what you want to show. Get off the video. Put on the screen what you want to show. Get off the video.
No,
okay,
can you see the screen sharing?
Yeah, but you picked the wrong screen to share. I think you picked the wrong screen. Go back again. Start again. You are coming to the right screen, but then you're picking the wrong screen to share. I think. It's okay. We'll get it. We'll get it.
Coming now. Okay, wait a minute.
Not yet. That's okay. It's okay. We got plenty of time.
Is it coming?
There we go. There we go. Yes, there it is. There it is. You got it. Now, okay. There you go.
Yeah. Dr. Suresh sir, Gupta sir, can you introduce yourself? Can you hear me?
Got it.
Yeah, I can.
Okay.
My name is Dr. Suresh
Okay.
Gupta.
Getting my
I'm based in Washington, D.C. and I'm a internal medicine and geriatric physician past 4 years. And let us see you this live chat. Thank you.
Thank you for coming.
Pleasure. My pleasure. Thank you.
Dr. Shiba, can you introduce yourself?
Whoop, she's muted. She left.
Yeah, Dr. John.
That's okay. We can start.
Dr. Vinod, you can start with your presentation. Dr. Vinod.
Hello? Well, it's okay. We have a little audio, I guess. Don't worry. We'll get started.
can you
Yeah, okay, there we go. There you go, Dr. Don. Okay. We can hear you. Hello, Dr. Bernard, can you hear us? No?
okay all today
Okay. Sporadic. You know, sir, this sometimes you have these problems with Wi-Fi.
Yeah, but he's in
no,
Malaysia, I think. Malaysia
my network is actually pretty good and I can hear you all.
Oh, okay.
So my
yeah.
can you all hear me?
Now
Yeah.
we can. Now we can. Now we can.
Okay, fine. So I just start again. Today our topic is on stroke rehabilitation. This is purely the physiotherapy perspective. What we did and what we presently doing and what we supposed to do, learning outcome. So used muscle re-education approach, and later years it an umbrella term called as neurodevelopmental approaches. Basically, three subclassification. One is sensory motor approach, who described is the roots, and movement therapy approach, and the third one is called as the NDT approach or neurodevelopmental therapy approach by Bobath and Bobath. And the next two are the one, even though it's still 1980s and 90s. One is a motor relearning program for the stroke, and the next one is the contemporary task-oriented approach. When we speak, these are the common approaches in physiotherapy used for treatment of or rehabilitation of stroke patient. All these individual approaches, they have a, and we just have a quick is approach basically working on the reflex theory. That's the meaning to say, if you produce any stimuli, it will end up in the response. So they used some superficial cutaneous stimulation like fast icing, fast brushing, fast stroking, slow icing, then vibration on the muscle, and just tapping over the temper of. They have given a joint compression over the joints to provoke spasticity or to reduce the spasticity. So many stimuli response theory they have done, and basically it is on the reflex theory. So reflex, when comparing uh, control theories, so root sensory motor approach describe about the motor learning. So it's a very old approach. From UK. Till today, famous approach all over the world, and in the Bobath, and their therapy is very simple. They say spasticity is the biggest culprit for the stroke rehabilitation, and the synergy is the worst culprit. Break the synergy by keeping some inhibitory postures and do always a movement out of synergy to facilitate. This is what their concept. So the altogether the cone concept is very simple. They want to reduce the spasticity pattern in stroke patient. Then only the normal move their approach, and still it has changed its color and used in many of the rehabilitation approaches all over the world. Then third one is going to be the Brunstrom movement therapy, which was developed by Sine Brunstrom around 1970s. Basically, she is a Swedish therapist. She just did a lot of assessment over 1,000 hemiplegic patients, and she made a classification of stages. Like all stroke patients has to come through stage 1 to stage 7. So she classified 7 stages for stroke rehabilitation. Based on that, when you see stage 3 is going to be the maximum spasticity level and high synergy level. So Brunstrom says every person after the stroke, if they get a hemiparesis, they have to come through the low spasticity, moderate spasticity, peak spasticity. Then the declination of the spasticity starts, that is reduction of spasticity to moderate, reduction of spasticity to mild, and at last no spasticity. So these people says spasticity is going to exist at stages in inclining and declining manner. So no this one, stop at any one stage of this one, and it is not going to be common for every person.
Excuse me, Dr. Bernard. Dr. Bernard.
Yes.
Dr. Bernard.
Yes.
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 The audio is not good. The audio is not good at all. We're not hearing anything. It's very sporadic,
Really?
and I don't want you to waste your. Yeah, I don't want you to waste your time. Is there any way you can get to a good internet connection or a wired
Actually,
computer?
mine I'm using is the
Okay, okay,
Yeah.
okay. I'm gonna have you test. Okay, I'm gonna send you a
same
program.
use that one.
Well,
Yeah.
I'm gonna have you test it. Okay, then you can tell me the numbers. But don't. I'm gonna. We'll start another hangout because the audio is very bad. Let me give you a link to test the speed of your internet, and you can tell me the numbers. I'm going to put it in the chat box. Okay, you know what the chat box is, right? Dr. Bernard? Hello, Dr. Bernard?
Hear you.
Yeah. I'm going to give you a link. Please check the numbers. It's a speed test.
Okay.
It's a speed test to check your internet numbers. I think that's a problem. But
Okay.
let's diagnose it here. Just
Okay.
tell me your upload speed, your download speed. But there's some kind of problem. The audio is.
John, close the air. It is live. Close the air and delete the link. This recording. Close the air.
No, I gave him the link. He needs to just test the.
You close the air first. It is live. close the air of the Hangout.
Close-
Off air.
Okay, well, okay, stop broadcast.